On the late year of 2019, a virus has made its presence known and have soon bent the world to its knees. The COVID-19 virus is a worldwide pandemic that have affected the lives of billions and have taken the lives of millions. According to the World Health Organization, the COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to the public health, food systems, and the world of labor. The massive effects caused by the pandemic to the public is downright devastating. Tens of millions of people are at risk of falling into extreme poverty and loss of quality healthcare. Millions of businesses face a constant struggle of bankruptcy. But what has the world done to prevent this? Even before the COVID outbreak, scientists, doctors, governments, and the World Health Organization have spent millions preparing for an unforeseen pandemic. Though many authorities were not quick to respond to the threat, nevertheless, once noticed, governments around the world began closing down their means of transportation and quarantining their citizens to lessen the surge of infections, as well as establishing rules such as social distancing and, more importantly, developing a vaccine to combat the virus.
COVID-19 cases continue to climb.
We are experiencing one of the worst COVID surges this winter with the Omicron virus, but experts say with this highly infectious variant,
the fast-spreading Omicron variant.
With the unpredictable nature of the COVID-19 pandemic,
people are going to pay the price. They're going to be the healthcare workers.
Omicron.
News media reported new variants of the coronavirus that have mutated, the most recent variant being Omicron, that is said to be spreading faster than any other variant that was discovered previously. The Omicron is now known to be far more contagious than previous variants of COVID-19, but appears to cause less severe symptoms than its predecessors, with data reporting that it is 35 to 80% less severe than the Delta variant, as stated by the Straits Times. Unfortunately, countries like the Philippines is seeing what may possibly be the biggest surge in COVID-19 infections this year, fueled by the said Omicron variant that could be the dominant strain by the end of January 2022, showing symptoms like runny nose, fatigue, headache, sore throat, and sneezing, as well as dry coughs and the loss of smell or taste. So, what can you do as an individual? COVID spreads through bodily fluids like saliva or sweat, so it's important to keep physical distance of at least 1 meter from others. Avoid crowds, social gathering, and close contact with people in public. They can still be carrying the virus even though they don't show signs of symptoms. Wear a properly fitted mask when physical distancing is not possible and in poorly ventilated settings. Make sure your mask covers your nose, mouth, and chin. Clean your hands before you put your mask on and even after you take it off. And clean your hands frequently with alcohol-based hand rub or soap and water. The recommended time for washing your hands with soap and water is about 60 seconds. Cover your mouth and nose with a bent elbow or tissue when you cough or sneeze. Dispose of used tissues immediately and clean your hands regularly. Most importantly, getting COVID-19 vaccines. Not only can it lower your risk of getting the virus, it can also prevent spreading the COVID-19 virus to those around you. Vaccines can also help prevent serious illnesses and death that the virus can cause. And these are some of the many ways that can help improve our daily lives through this pandemic, so we can go back to the life we had before this crisis. And as always, stay safe, stay indoors, and get vaccinated. Thanks for watching.